So for people with bags under the eyes or heavy eyelids, you call them blepharoplasty.
Yeah.
At what point is it they need filler, and at what point do they need what you call a blepharoplasty?
Yep. So, lower lid blepharoplasty is a very challenging procedure. And the reason is, basically, with the lower eyelid, what you're trying to do is you're trying to determine what is causing the lower eyelid to look aesthetically unpleasing. Okay? So and the way you do that is you have to look at what is the component of the lower eyelid. So we have skin, okay, and skin can look crepey or wrinkled, okay? We have muscle right underneath it. That muscle can be hypertrophied. It can also be, it may also have redundancy, which causes what we call a festoon, which is
like those fat bags.
Yes, exactly.
Yeah, I see that.
Malar bags like that also. There can be herniation of orbital fat, okay? So what you have to do is you have to actually look at what is causing the problem for the patient. They might have a significant herniation of orbital fat and also a tear trough deformity, Randy. And you got
to bags under the eyes.
Yep. Or a tear trough, or skin condition. So when it comes to what you're going to do, it's going to be dependent upon what is causing the problem. So if they're a candidate
for blepharoplasty, what are you doing?
It depends on what I'm seeing.
Okay.
If I'm seeing somebody with significant puffiness underneath the eyes, and maybe just some light wrinkling and maybe some tightening, I'm doing a transconj approach, which is the incision on the inside of the eyelid. I'm teasing the fat out, and I'm laser skin resurfacing that eyelid to tighten it up.
Okay.
If I see a patient that comes in and they're cadaveric, a lot of these
hollow? You're talking about hollow under the eyes?
Exactly,
okay.
hollow underneath the eyes. These patients have already had lower eyelid surgery, Randy. So what happens is they've become hollowed out. What I'll do for those patients is I'll actually put fat in.
Okay.
I'm restoring what was taken out and which caused the exposure of the orbital rim. So and
what about extremely crepey skin? You literally cut it out and then tack it to the underneath the eye?
Yes. Do
you recommend that, or you don't recommend that?
I try to avoid it. I like to try to keep my skin muscle unit intact if I can. But there are times when patients just come in and they're older, and they need to have that extra skin and muscle removed, or it's not going to. Okay. What I'll try and do with those patients is I'll try and tighten up the lateral canthus so that it keeps the eye in the appropriate position.
Okay, upper. What about the upper? That saggy upper eyelid.
First of all, as we mentioned earlier, look at the brows. Make sure the brows are in good position. If the brows are in sufficient position, then it's just a matter of determining what is causing the excess. Or what is causing the aged appearance of the upper eyelid? Excess skin? Is it fat? Whatever it is. And usually the incision is made in the natural lid crease. And then what we do is we excise the skin, and then I'll look to see if there's any extra fat. Now, when removing fat of the upper eyelid, one thing that I never do during surgery is I never pull up extensively on it. I don't want to skeletonize that. I only take what the eye gives me. Okay. So yeah, that's an important.
So the eyes, just by taking care of the eyes, upper and lower, could make somebody look 10 years younger.
Absolutely. Well, the
from
eyes
looking mad or tired to
the eyes are the windows to the soul. I mean, most people when they're speaking to you and they're talking to you, they're looking at you, and that and the crepiness, the heaviness, the puffiness, all those things send that subliminal message to the patient that this person's tired or they're working hard or.
Is that one of the first things that goes? Those eyes. Yeah. I mean, in and around the eyes. I think anybody over 50 knows. Absolutely. You look in the mirror and you're looking at the eyes.
Absolutely. And you want to know one of the main reasons why that is, Randy? Is because the eyelid skin is the thinnest skin on the body. And it is exposed to sun damage more than any other area on the face and on the body because of where it's located.
So you do a lot of eyes in your practice?
Tremendous.
Every week?
Tremendous amount. Tremendous. And it's something that, you know, usually goes along with some other kind of procedure. Like facelift and eyelid surgery is a very common procedure, because you don't want to rejuvenate this and leave this tired.
All right.
You know, so we'll combine those procedures.